There are 3 new cases of COVID-19 to report in managed isolation facilities in New Zealand today, 1 in Rotorua and 2 in Christchurch. And the one in Rotorua I think was quite well known yesterday. It's the same one. Once again, there is no community transmission in New Zealand. The first case we're reporting today is a woman in her 30s who arrived in New Zealand on 20 June, originating in Peru. She has been staying at the Ibis Hotel in Rotorua since arriving in New Zealand and tested positive for COVID-19 following routine testing around day 3 of her managed isolation. Everyone who was on that bus from Auckland Airport to the Ibis Hotel is of course being followed up. All the passengers are already in managed isolation in Rotorua, and the driver, who was wearing PPE, has also been followed up as a potential contact, isolated and will be tested. The second case we're reporting today is a man in his 70s who arrived in New Zealand from New Delhi, India on 20 June. He has been staying at the Commodore Airport Hotel in Christchurch. The man tested positive for COVID-19 as part of routine testing, day 3 of managed isolation. The third case we are reporting today is a man in his 30s who also arrived in New Zealand on 20 June from Ardhanpur in India on that flight out of New Delhi. He's been staying at the Commodore in Christchurch and also tested positive as part of that day 3 routine testing and managed isolation. Now, of course, any possible contacts of these 2 cases are being identified and followed up appropriately. Now, those needing to be quarantined in Christchurch, you'll recall in Auckland we have the Jet Park Hotel as a dedicated quarantine facility. In Christchurch, there is a quarantine section within one of the managed isolation facilities, so those 2 cases in Christchurch will be transferred and managed there for the rest of their stay. It's been previously assessed as a dual-use facility, one indeed that has an area set aside for that higher level of clinical care that someone with COVID-19 may require. Similar arrangements are being investigated in Rotorua, and in the meantime, the case that is currently in Rotorua is being transferred to the Jet Park Hotel to be looked after there. So our total number of confirmed cases of COVID-19 is now 1,169. This is the number we report to the World Health Organization. Yesterday our laboratories completed another new record number of tests, 10,436, bringing our total number of tests to date to 368,432. An update on a revised case definition and our testing strategy, and I've been talking about the shift in the approach to testing over the last few days. I've talked about that. So yesterday evening we released an updated case definition alongside our updated approach to testing. First, on the case definition. So the case definition is essentially a classification of people with symptoms that might be suggestive of COVID-19 to help the clinicians to decide whether or not they need to be in isolation, self-isolation, while awaiting the result of the test, and whether the medical officer of health needs to be informed because they're at potentially a higher risk of actually having COVID-19. And there are certain factors that are considered in assessing that potential higher risk than others who are just in the community. And these factors are whether they've had respiratory symptoms and they have had one of the following in the last 14 days. That includes contact with a confirmed or probable case, international travel, although as we know, those people will actually be in managed isolation, direct contact with someone who has travelled overseas recently or come in from overseas, a history of working on an international aircraft or shipping vessel, and may be involved in cleaning at an international airport or maritime port or areas that may be frequently used by international visitors. So alongside that revised case definition, which again is for our health professionals to assist with their clinical management, alongside this is the updated approach to testing. And as I've said over the last few days, we've now got a much bigger focus on the border, with the introduction of the mandatory testing for those in isolation, managed isolation, as well as surveillance testing around the border. including people working in those managed isolation facilities, people working around the ports or airports, and also some aircrew if they're coming from high-risk areas. So in addition to that, testing will continue in the community. And we can see, of course, with the high number of tests done yesterday, that which accounts for most of those tests done yesterday. And we will continue that testing as we have over the last weeks and months for people with respiratory symptoms, and they should continue, as has been the advice, to seek advice on getting a test. And as has been the case right since the start of our testing, clinical judgment of the clinician will apply, and rightly will be applied as to whether someone does or doesn't need a test, depending on the exact nature of their symptoms. So just the testing strategy again, in summary, the addition of that quite extensive testing at or around the border and ongoing community testing with a focus and particular high level of alert around people who may have additional high-risk factors around them. And so, arrivals at Auckland Airport. I've talked over the last day or two about the challenges, as you will be aware, of getting good data on individuals in managed isolation and being able to match that with laboratory results. I'm really pleased to say our team's worked very hard over the last couple of days with the DHBs in Auckland, and since a flight that came in 11 o'clock last night, we've had someone at the border working with customs to get the information on passenger arrivals and make that linkage with people on the NHI database so that we have that, so that by the time they leave the airport, we either have their NHI identified and we are able to therefore link them to other health databases, or if they don't have one, for example, they've been living overseas for some time, then we can work with the local DHBs to generate an NHI within a day or two. So I'm really pleased that our team has been able to put that process in place. At the moment, it's quite a manual place and has got someone, a manual process, and has got someone from the airport, from the DHB out at the airport, and we are working with customs and aviation security to be able to get a data feed of the people who, when the door is closed on an aircraft and once it's landed, those people who've landed, and we can start to make that match automatically through our data system. So I do want to thank the team up in Auckland and the Metro DHBs there who have worked really hard to get this in place so quickly. And finally, an update on the numbers I provided yesterday. In terms of compassionate exemptions, we have 2 people still awaiting results of tests, and we continue to work with enforcement services to follow up 1 person. I'm not going to talk too much, I'm not going to say anything more about that particular person except to say I'm aware of the circumstances and it presents a very low risk, but our team are working on that one still. So 40 have returned negative results, and as I said yesterday, 11 who are not being tested for a range of reasons. On the 2 cases that came from the UK and that were identified on the 16th, of the guests who were at the Novotel between the 6th and the 13th of June, which is the period that those 2 women were at the Novotel, there are 5 who are still outstanding of 190, and they continue to be followed up by finding services, and all staff at the hotel have now been contacted. Now to our 2,159 that I talked about yesterday. Again, I'd like to start by reminding anyone who will be in the country now who was in a managed isolation between June the 9th and June the 16th, who hasn't yet been contacted, or I should say returned a call from Healthline, because everybody has had multiple attempts to contact them. Please do so, and we need people to fulfil their part of this process as well. So the 2,159. There are now 1,184 who have been contacted and have tested negative for COVID-19. 800 of those, as I said yesterday, are people who we know were tested before they left managed isolation, and the remaining 384 now were tested after departure. 143 people have also been referred for a test, and we're awaiting results on them. We're still in the process of connecting with the balance, which is 695 people. As needed, we will refer people who we do not make contact with to finding services, reminding you that they get a text first and then a number of phone calls. So it's very clear who the call's coming from, and we're very keen that those people actually pick up the call, and if they haven't had a call, that they take the initiative and phone Healthline. 168 of those people, that was of the 695, had invalid numbers, so we're referring those people to finding services. This is where we use the customs and police databases to locate them. We've got 137 people who will not be tested because of reasons such as being a young child. They're part of a repositioning crew for a ship. They're currently now overseas, or some are refusing a test. And the number of people who've refused testing is 68.